The American Academy of Allergy, Asthma, and Immunology has concluded its annual meeting. This year, the conference was held from February 24th to the 27th in San Antonio, Texas, where allergy and immunology specialists gathered to reveal advances in the prevention and cure of asthma and allergic and immunologic disease. For more details and other highlights from the conference, I'm pleased to have Dr. David Kahn joining us to share his impressions of the conference. Dr. Kahn is a professor of internal medicine and pediatrics at the University of Texas Southwestern Medical Center in Dallas, and this year's president of the American Academy of Allergy, Asthma, and Immunology. Dr. Kahn, thank you for your time.
Yeah, my pleasure. Glad to be here.
So let me ask you, what was the overall theme of the conference?
So the theme of the conference is optimizing patient care. As president, we get to have like a little flavor of the conference, if you will, and one of my areas of interest was drug allergy. So there were certain sessions on drug allergy as well.
And what are a few of the conference highlights? Probably drug allergies, I'm guessing.
Definitely. In fact, I would say one of the typical highlights of the meeting are the plenary sessions. And so every day of the meeting, we have a plenary session. And so the first day of the meeting on Friday, we had our presidential plenary, which I had the privilege of kind of organizing that. And that was entitled Paradigm Shifts in Drug Allergy. So we had speakers talking about a condition called aspirin exacerbated respiratory disease, looking at kind of the immunopathology behind that. We had a topic on severe drug reactions, and then I kind of rounded things up by talking about our latest practice guideline on drug allergy. So yeah, it was a very nice session, if I do say so myself.
And you can. So what are some of the most significant abstracts presented during the conference, and how can these data be applied to everyday practice?
There were two that really kind of caught my interest. One was a study looking at patients who had reported histories of reacting to the COVID vaccination. And this has been something that as allergists we've been dealing with for some time. And so this was a study where it was a small study where they had patients who reported these reactions. And what they did was very clever. They did a placebo-controlled administration of a second vaccination. And as it turned out, there were more people who had reactions to the placebo than the actual vaccine. In fact, almost all of them had some type of symptoms, and the typical symptoms that we saw were not really allergic, but could be mimics of an allergic reaction. So they complained of dizziness or lightheadedness or numbness of their lips and tongue. And this is something now that we're recognizing as being quite common for these patients who report what they think are allergic reactions. And the terminology is something called immunization stress-related response syndrome. And this has been reported prior to the COVID pandemic, but I think it's been accentuated by the COVID pandemic and kind of these newer vaccinations. I would say the message is that the vast majority of patients who've had reactions, which they think are allergic, can actually receive subsequent vaccinations and do this safely. And there have been a number of studies to show that. The other study I would say that was of interest to me, again, in a drug allergy topic, relates to what we call penicillin allergy delabeling. Penicillin allergy is the most common drug allergy amongst patients. About 10 to 20% of patients report this allergy label. And as it turns out, having this label is not benign. So these patients are treated with other antibiotics, usually more broad spectrum antibiotics, and they suffer consequences because of that. They're in the hospital longer. They can have more serious antibiotic-related infections. There's even higher mortality. Now, if you look at patients who have this penicillin allergy label, when we test them, turns out probably 98% aren't allergic to begin with. And so when we test them, we remove that label. We call that delabeling. So this study looked at this delabeling process and found that in the health record, 99% were delabeled. But when they contacted the pharmacy, which they sent letters to, a third of them still had that label in the pharmacy. So again, an obstacle for patients getting appropriate therapies.
So, one study presented during the meeting showed that despite being more likely to develop asthma, Black children diagnosed with atopic dermatitis are less likely to be evaluated by an allergist than white children. What are some explanations for this finding, and what are the AAAAI and others doing to minimize these types of disparities?
As it turns out, other studies have really kind of pointed out this issue with health disparities in not only Black children, but other Black individuals with asthma. And this is likely due to a number of different factors, but primarily due to social determinants of health that lead to these disparities. And this would include access to health care, economic instability, environmental injustice from pollution, and a variety of other factors. The Academy is really committed to diversity, equity, and inclusion. And so we actually have a committee focused on DEI. They've actually published a work group report that highlighted some of the disparities that we see in our allergy field, including asthma, food allergy, other allergic disorders. They've started a webinar series in process on a variety of different topics. One of my initiatives as president was a program called Regional Outreach for Allergy and Immunology for Residents. And this is a program that we targeted different geographic areas in the country to not only tell primary care residents what we as allergy specialists do, but also to promote the specialty to individuals.
In another study presented during the meeting, researchers found overutilization of inappropriate food IgE testing in patients with chronic nonspecific symptoms, which led to unnecessary anxiety in patients. What type of nonspecific symptoms prompted the testing?
Yeah, so this is this abstract kind of highlights an issue that's been long-standing in the field, and really this is less of an issue for allergists and more for other probably primary care physicians. And the most common reasons that people were getting these tests didn't sound at all like food allergy, or behavior issues or chronic abdominal pain. And these are not manifestations of food allergy. So when you order these tests for the wrong reason, you'll get answers that don't help you. And in fact, there's a lot of false positives with food allergy testing.
So, in conclusion, Dr. Khan, the annual meeting is the culmination of your term as president this year. What are a few highlights of the significant work done during your presidency?
Yeah, so I had a few different initiatives during my presidency, one of which we've already kind of touched upon, this ROAR program. The other was, I think you've heard it from me already, that I have a very big interest in drug allergy. And so I was able to get a grant approved by the board to study, to provide research funding for drug allergy. And then my third initiative, which was a little bit more ambitious and obviously will continue to go on, and that is I started a task force on prior authorizations. So as you know, prior authorizations are a big problem for physicians, for patients. Serious adverse events happen because of delays in care because of this, including hospitalization, and even some people had patients that died because they had delay in care from not getting access to the medication that was recommended by their physician. So ongoing problem. We have advocacy that we've been working on, and again, we're not going to solve this problem by ourselves, but I think there are some things within our specialty that we really want to raise. It's something that we need as physicians to continue that fight.
Dr. David Kahn, thank you so much for your time today.